Hello, everyone. I know that is the different time in each of your country. In Vietnam, this is the evening time. And I am Dr. Xuan from the University of Medicine and Pharmacy in Ho Chi Minh City, Vietnam. Today, I would like to share with all of you one of the study. I conducted study with one of my students in the Becamec Hospital in Vietnam. It talk about the nurse compliance on patient handover process in pre-operating room. So I will start with the clinical handover. Handover is the transmission of patient information in a comprehensive, systematic, and accurate way to the other medical staff. The purpose of handover is that all medical staff will have a similar understanding about the patient. An accurate handover in clinical information is a great important to continuing care of patient safety. So that's why a poor clinical handover has been identified as a major contributing factor in serious adverse events and significant cause of preventable harm to the patient. And the information handover were responsible for 25 to 40% of the adverse effect post-surgery. Besides that, a wrong-side surgery is estimated to occur around 40 times per week in a hospital and also clinic in the United States. And the surgical accident also include wrong procedure and wrong personal surgery. Moreover, among adults undergoing major surgery, the complete handover of intraoperative anesthesia care compared with no handover will associate with a higher risk of adverse post-operative outcome. In Vietnam, along with the change and improvement in the healthcare model of the hospital and medical facility today, patient handover is becoming more and more concerned and elevated. The Ministry of Health has stipulated that when the clinical nurse delivers the patient to the operating department, clinical nurse have to hand over the patient and transfer to the medical record and assigned to the patient at the surgery department. However, under we have the policy in most of the hospital, the accident and the misunderstanding between nurse in the handover process still occurring in Vietnam. And that's why we come up this study. Um, in the literature review in Vietnam, we still meet the study about the handover process compliance. However, there one study in the military hospital in 2015. They show that the handover process still had many shortcomings. Inadequate medical record. Nurse receive patient without rechecking patient information account around 3.3%. And besides, the proportion of nurses who had not signed into the handover book account around 48%. And this study, we conduct this study with two objectives. The first one is to determine the level of nurse compliance during the pre-operative patient handover process. And the second thing is to examine the nurse evaluation on using the pre-operative patient handover checklist. So that's why we want to know that can the nurse use the checklist developed by the hospital to apply the handover process during their workshop daily. This is utilize a descriptive observational design with a cross-sectional approach. We investigate the series of pre-operative patient handover case in 3 months in the Becamec Hospital in Ho Chi Minh City, that is the south of Vietnam. The target population of this study were the staff nurses from different departments in Becamec Hospital, the surgical department, maternity department, obstetric and gynecology department, emergency department, and anesthesia department. The inclusion criteria were the official nurse and handover case of the scheduled surgery and semi-emergency surgery. So we will exclude the emergency surgery. Besides us, the nurses who were in the probationary periods were not also selected for this study. And although this study main subject were nurses, however, the sample size was the handover case, which were performed by nurses. Therefore, each nurse who transferred the patient were observed and as an average of 3 to 5 handover time. And for the anesthesia nurse who work in the surgical department, because the limited of the number of nurses in the surgical department, so the anesthesia nurse will receive about uh, 32 to 33 handover times. And we try to ensure that the number of the patient handover case for each nurse were more equivalent from each department. This is the research instrument. We use the medical file record to identify the indication of the surgery of the patient. We apply the pre-operative patient handover procedure of the Beckerman Hospital. We have also the checklist to assess the nurse compliance on handover pre-operative patient. We also have a questionnaire form to ask for the nurse evaluation on using the pre-operative handover checklist. To test the instrument reliability, the pre-operative patient handover procedure were approved and issued by the Beckerman International Hospital Board on 2017 and currently is in use at the hospital right now. The checklist of assessing nurse compliance on handover pre-operative patient were calibrated on category from the Beckerman International Hospital procedure. And and the checklist include 38 items with answer yes or no, and for compliant or non-compliant. The compliance level based on the rate of completing the checklist with 38 items. And according to the scale, the low compliant when the answer is yes, lower than 60%, and the medium compliant is around 60 to 90%, and high compliant for handover process when the result is over than 19%. And the survey form of nurse evaluation is on using the pre-operative patient handover checklist. We use the questionnaire were edited from technology acceptance model study of David in 1993 with 5-level Likert scale from strongly agree to strongly agree. And this survey were reviewed and commented by 5 head nurses from 5 departments where the data were collected. And though there were no change in the content of the survey question because all the experts agree that this form were valid and all the questions were easy to understand for nurse. So this is on the left on the right hand side. This is the checklist of the Beckerman Hospital in Vietnam, and this is the item that we try to translate from Vietnamese to English. For data collection, during the period of data collection, the principal investigator observed the handover process between clinical nurse who transfer the patient to the surgical nurse who received the patient at the operating room. And we evaluate their compliance by filling the box in the checklist. And after that, all the nurses participating in this study were given the survey to ask about the evaluation of using the pre-operative handover checklist. All the question and answer in the survey were explained by the principal investigator to all the nurse participants before before they fill in on the questionnaire survey. After data collection, all the data were input into AP data software, and then we use our software to process analysis data. The data were presented in descriptive statistics, include frequency and percentage. And now we move to the ethical issue. This study get the permission from the Medical Ethics Council of the University of Medicine and Pharmacy at Ho Chi Minh City, Vietnam. And all the participants, that is nurses, were clearly instructed and explained about the purpose of the study. Voluntary participate and sign the consent form, and they have a right to refill or stop anytime. And on information of research participants were confidential and ensure that they are not affected by any benefit in their work. Now I move to the result of this study. So for the surgical classification, we nearly have the equal percent of the scheduled and semi-emergent surgical around 54.1 compared with 45.9. For the characteristic of nurses who participate in this study, we collect 53 nurses in all 5 departments, and most of them are female. And I think this is the same, the difference between the gender in nursing field, because female only is approximately amount. And for the educational level, 41.5% of nurses are at the level of the bachelor, and more than half of them is around at the college level. So you can see that in Vietnam, the level of education of nurse quite still low in a hospital. And for the work experience, approximately nurse have the experience around 5 to 6 years, and around 20% of them were over than 10 years. We not include the nurse who don't have experience in this study. And most of the nurses are still young because they are usually from 30 to 40 years old. The main result of this study is the level of nurse compliance on the handover process. And the results show that we have 71.9% of the nurse who have a high compliance on handover process, and 28.1% comply the handover process with a medium level, and no and 0% of low level. However, when we see to the compliance rate according to the handover content in 196 case of handover, we can see that for the content of handover, there are some items that need to consider it, because for the content of patient need to be isolated, we can see that only 63.3% that the handover case will apply with the compliance. So that means the nurses also not pay attention on this item. And currently, with the outbreak of the COVID-19, this situation, this content is very important for nurses, need to be comply when doing the handover process. The other thing is about measuring the oxygen saturation, asking about the antibiotics use, time to use, or at the time that arriving the anesthesia department were not transferred or recorded in the medical file complied by nurses. The other content, such as identifying patient information verbally or identifying patient information by hospital bracelets, only account around 75 to 77%. It's also quite low, and it is also a very important item that the nurse should to be pay attention more. Marking the surgical site is also one of the items that we need to concern more. The second objective about the nurse evaluation on using pre-operative patient handover checklist. We have 6 questions with us about the uses of the checklist during the handover process. So usually we have around more than 40% that agree to use this checklist and strongly agree for this checklist. However, in the question 6, In opinion, should this checklist be widely applied to the other hospital? We have around 2% that strongly disagree. And that's why we have the question with maybe we wonder that the checklist that developed by the hospital, the Beckerman Hospital, may be only familiar with the location in their hospital, maybe not familiar with the other hospital as well. And when we compare our study finding with the others researcher finding in the research in 2015, we can see that the background information and also vital sign of our study is the nurse compliance is lower than the other study. And identifying patient information verbally or identifying patient by hospital bracelet is also very low. Although Beckerman Hospital is an international hospital and the hospital has a policy for nurses to apply it. However, we think that the nurse here still have not um, like a training or have the good policy for applying the handover process. However, when we compare about the preparing surgical skin and mark the surgical site in the research of another hospital, we can see that the level is lower and than our study. It only takes around 28 to 15% of the nurse comply on the handover process about the surgical site. So this point is depend on the perspective of each hospital and the policy of each hospital, because sometimes repairing the surgical skin or mark the surgical site may be the task of the surgeon. So maybe nurse in some hospital they not pay attention to that content. And the other difference between our study and another study is related to the patient rectally clean and nurse transfer the patient side or receive the patient side. So in our study, the nurse is complies more higher than the other. So the conclusion of this study is that the process of pre-operating patient handover process at Beckerman International Hospital in Vietnam were consistently with only 71.9% at high level of compliance. And there was still some content that nurse need to be compliant more, so that mark surgical site, time to use antibiotic, identify the patient information verbally and by the bracelet, and patient need to be isolated. In addition, this study received a positive review from nurses on using the handover checklist for patients before surgery, and over 90% of nurses agree that that checklist were really effective, helpful to use, and could prevent the medical accident related to the surgery. We also withdraw the recommendation for this study because this is only the limitation of this study is that we conduct in the the small number of nurses in one hospital, and the instrument like handover tool, handover checklist is developed by localized by this hospital. So in future study, maybe we could deploy a new handover tool with enhanced nursing communication, so that helping nurse can transfer the person is easier, short, reduce of time and more effective. And it's also the necessary to explore more creative way to conduct the patient handover. And handover procedure in hospital and medical facility also need to be constantly updated to ensure the patient safety and suit with the innovation of the health system in the world. So that's all of my presentation today. Thank you very much for listening, and I hope that we can share the experience in Vietnam with you by the question and answer. Thank you.
Anyone had any questions for Dr. Xuan? Please go ahead. Drop your questions in the chat box, or else you can directly ask the questions by unmuting the audio. I repeat, if you have any questions, please go ahead. We have already shared the mail ID of Dr. Xuan so that you can directly reach her through the contact mail ID.
Okay. Yes. I welcome all the questions for you by the email directly here.
Sorry.